You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about the latest medical advances in the treatment of varicose or spider veins. If you have unsightly veins on your legs, hands, or face, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Inam Huq. Dr. Huq is a board-certified general and vascular surgeon. Dr. Huq has been performing vascular surgery for the past 30 years. We've invited him on the program today to discuss advances in the removal of unsightly veins on the legs, hands, and face. Dr. Huq, welcome to the program.
Thank you. My pleasure.
Now, before we get into today's topic, in New York, you have one of the biggest vein centers out there. Tell us a little bit about your practice.
Randy, I'm a vascular surgeon, and I have been involved in practice of vascular surgery in Brooklyn for the last 35 years. During that time, I have been treating both arterial and venous disorders. Okay. But over the last 15 years, my practice has shifted to exclusively treatment of veins and venous disorders.
So it's all you do there?
That's all we do.
You teach the topic as well, is that right?
Yes, we do. Actually, we have physicians from all over the country who come to our office for training and for.
Oh, is that right? So it's a training center as well?
It's basically a training center. Last week we had a physician who came from Bosnia. I don't know how.
From Bosnia?
From Bosnia to learn this technique. She told me that there is nobody over there who is doing this kind of work, and she was very excited.
Okay. Now, you're also an assistant professor at Mount Sinai. What is your role there?
Yes, I am. I'm an assistant professor in surgery at Mount Sinai School of Medicine. The residents from Mount Sinai School of Medicine come to Maimonides Hospital, which is a very prestigious hospital in Brooklyn, where I practice, and I teach them about surgery and about vascular disorders.
So no matter how big or small, you could take care of it.
That's correct. As I was saying, it can vary from those spider veins to those big bulging veins that cause swelling and achiness in the leg. And when the problems really get bad, you get patients who have complications from these varicose veins. And they include phlebitis, a formation of blood clots, leg ulcers that become very painful and very difficult to treat, and constant swelling, and we treat those patients too. So we treat, in the vein center, a whole spectrum of venous disorders.
All right, now anticipating this interview, and we're here at the CBS station here in California. I guess here in California, an RN can do it. Any physician, medical doctor, licensed can do it. Who should people look to get that procedure?
Well, you have brought about a very, very important point, Randy. Because the venous procedures have become well known, every physician and every healthcare professional is trying to do it, I guess, to add revenues to their practice.
Well, they have come to me, by the way, and, that want to get on the show, and I say, is this all you do? And they say no.
But this is one of the reasons for me to come to your show, to inform the people and the public as to what kind of physician they should look for if they want the right kind of care for their vein.
The vascular surgeon seems like the natural guy to go to.
Well,
and this is your specialty.
The vascular surgeon, by his education and training, is the person who takes care of venous disorders and who is familiar with the different complications and the problems that can happen from varicose.
Does it frustrate you that any medical doctor can do this? And the public, I guess, doesn't know?
It is very frustrating because the patients get suboptimal care.
When you say suboptimal, what do you mean?
Well, suboptimal means that the patient will come and have the treatment done, but the problem that the patient is having may not be properly addressed. The patient may have temporary relief of her spider veins, but the spider veins will come back.
They can come back.
They can come back because the root of the problem has not been properly diagnosed.
And that happens? That happens?
It happens very, very frequently. We actually have patients in our office who say that they had their veins closed or veins stripped, and they come back. We do an ultrasound examination, and lo and behold, the saphenous incompetent vein is still there.
Okay.
And it's no surprise that after a year or two, they are back to the same problem where they started from.
Okay.
So it's a wastage of time and money.
So there's a lot of technique involved? Is this...
There is a lot of training and there is a lot of precision that is involved in carrying out these techniques.
Tedious work?
It can be tedious work for somebody who does not really know.
Okay.
For somebody who is properly educated and who does on a daily basis, it becomes very gratifying work.
Why do you like doing it? Because I've talked to doctors. They said, well, that is tedious work.
Well, I like doing it because, one, you can do it in your own office. You can do it on an ambulatory basis.
Okay.
You can provide relief to the patient for a problem for which she has been seeking treatment for a long time.
So a happy group of patients.
A happy group of patients. It is very gratifying to see a patient come back after the procedure. They're happy, their life has changed in the sense that previously they were not able to go out and enjoy themselves in public.
You say they, I mean, some of your patients say that they haven't worn shorts in 20 years or a skirt because of their vein problem.
That is correct. I mean, when I started vein practice, I was really surprised as to how self-conscious women become because of these spider veins. They become introverted. They will not go out in public with bare legs. They will not like to go on the beach and expose the varicose veins, because to them it seems like an insecurity that they are trying to constantly hide.
Yeah, because I looked at your photos, and by the way, if you're just tuning in, I mean, these photos are dramatic, these before and afters, and you're saying without surgery. But I don't see legs like this. I don't see these veiny legs.
Well, the varicose veins are very common, Randy. You don't see them because you don't see patients.
They're hiding them, you're saying?
They're hiding them. Most of the patients who have these problems would rather not expose their legs in public.
For varicose veins, stripping, the stripping method, which requires a hospital stay, and we've talked on the telephone, you say that that possibly is a thing of the past. But it's still being done today. It's
still being done. And it brings me back to the same point. The proper training and awareness, even among physicians and healthcare professionals, is really lacking.
So those big bulgy veins, you're saying you don't need to do a stripping procedure?
Absolutely not.
Really?
Absolutely not. Over the last 10 years, when we started doing this laser closure.
So laser closure.
Laser closure, it's one of the methods, and we will talk about it. I have not done vein stripping. Now, I'm a vascular surgeon by training, so before that, we used to do vein stripping, and that involved taking the patient to the hospital, general anesthesia.
It's still being done today. Now, why?
It is still being done because, as I said, most of the physicians are just following the old techniques. They have not bothered to learn the new procedures. And
does insurance cover these new procedures?
Insurance covers most of these varicose vein problems.
Okay.
You know, if you have symptoms like swelling in the leg, which most people have, or achiness, or tiredness, or pain, any of these symptoms, then it's a medical problem, and the insurance will cover it. If it is purely cosmetic, they may not. But the vast majority of patients are covered by insurance.
So what are the different methods or approaches to vein elimination?
Randy, there are different approaches available to treat varicose veins, and certainly one treatment doesn't suit every patient.
Okay.
There is the old-fashioned vein stripping that is hardly necessary for any patient. Then there is the newest technique, which is thermal ablation or closure of the ballooned out or incompetent vein.
That's a laser.
That's the laser.
Okay.
And then there is the sclerotherapy, or the injection method.
Just inject the vein?
Just inject the vein, and that generally is more suited for those fine spider veins that are more or less a cosmetic problem.
Okay.
And those three modalities are the ones that are available.
But don't you need those veins? The part I don't quite get is are you collapsing? Are you removing, dissolving the vein? And also, don't you need those veins? And how do you live without them?
Now, Randy, what happens is that you have thousands of normal veins in the leg. It's just that one vein that runs from the groin down to the leg, called the saphenous vein, which has the tendency to balloon out and stretch in some people, so that the blood, instead of flowing back to the heart, backs up in the leg. That backing up or leaking of the blood into the leg over years then causes bulging of the branches of that vein. And that's what you see as spider veins, varicose veins, those big bulging veins. And those veins are redundant.
You don't need them.
You don't need them. They're interfering with the circulation. They are not letting the blood flow briskly back to the heart as it should. So eliminating those veins restores your venous circulation.
So what's causing the pain? You say that they're painful.
The pain is, one, stretching of the vein because of the leaking of blood into the leg when you stand. That stretching of the vein hurts. The blood stagnating in the leg can cause inflammation and irritation of the skin and the tissues in the leg. That can become very painful. As you know, the blood, when it keeps flowing, remains fluid. If it becomes stagnant, it tends to clot. And that's what happens in some of these patients with varicose veins. These bulging veins make the blood stagnate.
So once you collapse them, then what? The pain goes away immediately? The next day?
It's very dramatic. Once you correct the circulation and get rid of the blood leaking into the leg, the symptoms promptly disappear, which, by the way, could be disabling: swelling, achiness, heaviness, tiredness in the leg.
Okay.
The leg looks much better because you don't have that unsightly varicose veins that are there.
So you're collapsing it, dissolving it with the laser? What are you doing?
Well, what you're doing is that you are closing the ballooned out vein with the laser. The laser energy, which basically is thermal energy or heat energy, seals and closes that ballooned out vein. The vein then shrivels to a thread, is dissolved by the body and disappears.
Interesting.
Yeah, it's a fascinating technology.
And that's brand new. I mean, for the most part,
this
last
is
5 years?
Brand new. I mean, it has become state of the art now, but the treatment has been there for the last 10 years. And in our area, we were one of the pioneers in advancing this treatment. And currently, we are one of the busiest centers on the East Coast.
So you're the busiest center in New York?
We are the busiest center in the New York area.
Is that right?
That is correct.
Dr. Huck, we're going to take a quick break. We come back, and we'll take a look at these photos, what you've done, because these are really amazing. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about vein elimination, some of the new techniques with Dr. Huck. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about vein elimination, some of the new techniques. With us we have board-certified general and vascular surgeon, Dr. Huck. Okay, Dr. Huck, you brought some photos. What are we looking at here?
Well, Randy, for example, this is the patient who worked as a contractor. He had these extensive varicose veins, and the poor guy was in pain and in terrible discomfort, to a point that he was not able to do his job. He came to me, and as you can see, he had advanced varicose veins.
So when you look at that, by the way, on a consult, in your mind, you say this is an easy one to take care of?
Well, it's not an easy one. It does involve a certain know-how and a lot of experience to be able to deal with this patient effectively. But I do smile because because he has been refused by a lot of other physicians, saying that this is a hopeless condition.
Really?
Really, they tell them that you just wear the elastic stockings and live with it the rest of your life. That is correct.
Okay.
And this is the result after 2 weeks.
Really? Let me take a look at this. 2 weeks later.
2 weeks later.
It doesn't look like the same leg.
No, it doesn't. But this is the same patient. His varicose veins are gone. His leg is slimmer. His symptoms cleared up. And something that I did not expect, because it takes a long time to go away, is the pigmentation. As you can see,
there's no color.
The black pigmentation has cleared up, and this is a normal leg.
How many treatments, by the way?
This was one treatment.
One treatment in your office?
One treatment in the office. After the treatment, the patient walked home, took it easy that day, was pretty much back on his feet.
But no pain after the fact?
80% of the people do not have any pain after the procedure. Randy, here is another patient who was very interesting. This is a patient who is a school teacher by profession.
Okay.
And he would stand.
That looks pretty bad, by the way.
It does.
Is that common? You say it's common.
It's very common. I mean, the varicose vein problems and blood stagnation in this person has advanced to a point that he's getting ulcers at the ankle, which are very extremely
I guess I just
painful.
never see it. These people hide their legs.
These people hide their legs. They actually go from physician to physician asking for help, and nobody really knows how to properly take care of them. That is correct.
Okay.
And this patient was treated with laser closure of his ballooned out vein, and his varicose veins were removed.
Let's take a look at that after.
And this is after his treatment.
Nice.
As you can see, his leg ulcers cleared up, his varicose veins went away, and he was able to function as a teacher again.
In your office, how long does this take for you to do?
It varies. The simpler cases can take about half an hour. The longer cases can take about an hour.
We have time for a few more.
Randy, let me show you another patient. I mean, this patient came all the way from Israel to have her veins treated.
Because they heard about you?
Because they heard from me.
Is that right? Okay.
Somebody who had treatment done and went to Israel. And this was a dancer who was a very good dancer until about a few years ago when she developed these bulging veins. And
did you inject those?
No, these were treated by laser closure of the incompetent saphenous vein.
That's amazing.
And after that, she basically danced into my office.
She danced into your office,
danced into my office. She hugged and kissed me.
Is that right?
She said, I have changed her life, which I believe.
That you did?
Because it did make a big difference to her.
Self-esteem obviously is improved.
Self-esteem is improved. You don't have the continuous pain and tenderness in the leg.
It's a sexy leg, by the way, on the after.
It was a beautiful young woman who came to my office, and it was so gratifying to see her after the procedure. Randy, let me show you another patient. This one is a person who used to work in an office.
Well, this is incredible.
And developed these big, huge bulging veins. And people will, in the office, when he will wear shorts, or when he would be courageous enough to wear shorts, will laugh at him. They think that he has some kind of a tumor on his leg.
Yeah.
But he was treated in the office with a laser closure and phlebectomy, and you can see
the after. Very nice.
The results.
Yeah.
And he was very, very happy. He said that on his first birthday after the procedure, he got about 12 shorts as a present.
Is that right?
To wear outside.
So if 80 million people, mostly women, have varicose veins, and it's this easy, an hour visit, why aren't they all doing it? I mean, insurance covers most of these procedures.
That is a good question.
They just don't know about
it? The thing is that the public information about varicose veins and about the treatments that are available is lacking. It's not only lacking among patients,
amongst physicians.
Lacking among physicians and healthcare professionals.
Medical doctors will watch this show. What do you want them to know about what you're doing?
Well, I would like them to know that there are techniques available that can treat varicose veins and the complications that happen from them on an outpatient basis, where patient will come, have the treatment done, walk home, and get relief of her problems.
Now, we're just about out of time. But women, so no matter how big the vein is, you could usually treat it.
Yes.
Without surgery.
That is correct. It basically can be done by an outpatient procedure.
What about the little veins?
Little veins are very common. These are more common in women than in men. They make them very self-conscious, so that they withdraw into themselves. They do not like to go out socially.
They withdraw, you say?
Okay. That is correct. They would not go on the beach and expose their legs.
Is this what they tell you on the consults?
That's what they tell me, and I get surprised as to how often this is true.
Okay.
This, for example, is a patient who had these unsightly veins on the leg and was not able to wear a skirt in public or go out on the beach and wear a bikini. So she came to me. She was treated with sclerotherapy in the office.
Sclerotherapy is the injection technique.
Sclerotherapy is the injection technique.
Sounds like it hurts.
It does not hurt. The injection treatment is given by a very fine needle, which is like a hair. So most people don't have any pain from it. Sometimes we will supplement it with a laser treatment of the superficial veins also. And a combination will give very dramatic results to a point that the patient has complete resolution of the veins.
Is early treatment, by the way, better than later? I mean, when should somebody do it?
Yes, no question about it. The earlier you treat these spider veins, the faster the resolution and more effective it is.
Okay.
Easier to do. So yes, I would recommend it that people should take care of them at the earliest that is possible. Randy, let me show you another patient. This is a patient who had spider veins around the ankle. And that made her so self-conscious that she would not wear a sandal or go out in public.
Okay.
And this is after her sclerotherapy and a skin laser treatment.
Okay. Now these photos are not touched up. I mean,
no, they have not been touched
up. It's very
up.
nice.
They're original pictures, and
so people probably put this off for a long time before they do something about it.
They do, because they do not have the necessary information to go and seek treatment. They do not know that effective treatment is available, that it is easy, that it's available on an outpatient basis. And then they do not have access to the competent physician who can take care of it. They may have gone to an RN or may have gone to a physician who doesn't know how to properly do it, and the spider veins may have come back. So it would greatly discourage them from going back and seeking treatment again. Along the same lines, this is a school teacher who had to stand on her legs, and this is the kind of roadmap.
If you take a close look, there's a lot of little veins here.
That is correct. And this is after her treatment with sclerotherapy and the skin laser.
Interesting. I mean, just a completely youthful leg.
That is correct. And it can be a life-changing experience once this thing clears up, these spider veins. These people have an entirely different take on life.
Really? A different take on life? Sounds like you're exaggerating a little bit.
No, I'm not. If you should come to my office and see these patients yourself.
So the patients are really that happy?
They're happy, they're ecstatic that the problem that they did not think could be taken care of has been eliminated on a permanent basis.
Okay,
and that's the most gratifying part about the vein practice, is to see these happy patients and good results on a consistent basis.
Now, some of the people you say come in bad condition, like ulcers, things like that.
My practice is full of patients who do not treat their varicose veins for a long time and then come back with complications. And complications can be formation of blood clots in the leg or phlebitis, or formation of leg ulcers. The stagnation of blood constantly in the leg irritates the skin to a point that it gets inflamed and breaks down, causing these very painful and difficult to treat leg ulcers.
Okay.
And these patients go from physician to physician seeking help, and nobody really knows what to do about them.
Does that amaze you, by the way, that more of the mainstream traditional medical doctors don't know about this? I mean, everybody's busy doing what they're doing. It's obvious.
It does, and that's why I have taken up a program of inviting physicians to my office and telling them about these new modalities available.
So this photo right here, I mean, this is an ulcer? What am I looking at?
This is a patient, actually 70 years old, who had this leg ulcer for the last 20 years.
Terrible.
And had been going to different physicians asking treatment, seeking treatment. Randy, look at the bottom of the leg, and you will see this bulging.
The front of the foot.
The front
it's covered.
The front of the foot is covered with varicose veins. And these varicose veins are making the blood irritate the skin.
So what method did you use to get rid of this?
We closed the offending ballooned out vein that was making the blood leak back into the leg and make these varicose veins and the ulcer come out. And this is 2 months after the treatment. This was a man who was completely changed. He's 80 years old. For the first time in the last 10 years, he took his bicycle out and was able to ride it comfortably. And this was one of the most gratifying patients that we took care of. This is by no means the only patient that we have treated with leg ulcers. Actually, we routinely take care of these problems. You can see this patient is a steel mill worker who had these varicose veins and leg ulcers that were practically making him disabled. I mean, the man was on disability. He could not earn his living. And he came to my office really in tears because nobody had been able to help him.
So people like this have gone to other doctors. They're told, not much we can do.
That is correct.
So they wear Band-Aids over these all the time and just live with it?
They wear some elastic stocking or different kind of bandages, but they do not really help.
Okay.
After his vein treatment in our office, this is his picture a couple of months later on. Different person.
It's very good. It's
able to resume his work and be relieved of this chronic disability permanently.
I also wanted to ask you, when I was looking at unique things about your practice, you're one of the only centers with Joint Commission. Is it accreditation? Is it graduation? What is it?
Certainly, Joint Commission is an organization that goes to different healthcare facilities and sees if they are really up to par. Right now, for outpatient facilities, it is voluntary. we voluntarily submitted to a very exhaustive procedure of checkup by the Joint Commission, and you will be glad to know that we got a complete bill of health, a complete accreditation.
Good.
So we are right now the only vein center in New York which is fully accredited by Joint Commission.
All
and
right.
We are very proud of it.
Good, good. I want to thank you for coming on the show. Very interesting.
It was my pleasure. I hope it helped some people understand the venous problems and how to take care of them.
So final message, somebody watching this, they have these unsightly veins, maybe they were told elsewhere, not much you could do. What do you say to them?
Basically that they do not have to live with these unsightly and painful varicose veins, that the effective treatment is available, that it is easy and does not involve any prolonged out of work or taking time away from work.
Okay.
And that they should seek the person who has proper training and a lot of experience in taking care of this thing. That really matters.
Okay, good. Thanks again. Very, very good. Very interesting. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to watch this again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.